Hello and welcome to the April LLR LMC podcast with a roundup of what's been happening in LLR in general practice land for the last month and supporting our newsletter. Joining me today, I have Dr. Fahreen Dhanji, who's the Deputy Chief Executive, and I've got Charlotte Woods, who's our Operations Manager and the glue that keeps us all together and tries to keep us all sane. So kicking off today, first thing is to congratulate Fahreen. So Fahreen stood for to be the GPC member to represent LLR and Northamptonshire. It's a 3-year post. The GPC is a very influential and a very important thing in general practice land, because they're part of the BMA that deals with general practice issues, and they are the people that talk directly to government and other bodies about general practice. Just a declaration of interest, I was a member for 25 years, but I haven't been on since 2018. Our last member was from Northampton, and I know you shouldn't talk ill of other people, but to be honest, he never turned up to a single LMC meeting. He never sent us a single report, so we are looking for great things, building on that wonderful starting point from Fahreen. Just saying that the previous person we'd had, representatives from Northamptonshire going back quite a few years, did come to every single meeting and gave us sort of regular updates and regularly interacted with us. So it wasn't just because I was from Northampton, it was to do with that individual. So anyway, so fantastic good news. I hope you all with me to congratulate Fahreen and wish her a wonderful 3 years. And from my point of view, just say, get stuck in. And there's never a stupid question, just keep asking them. But just keep hassling if you don't get an answer. That's the way it seems to work. And just try and get involved in the day-to-day work of the GPC. And you can have lots of interesting interactions. So, and then next on the list, we've got BadgerNet, for which actually I'm going to turn to Fahreen to tell us about.
Yeah, so thanks for that, Grant, and thank you for the congratulations. Looking forward to the job, and it'll be quite interesting now that we're clustered with Northampton. So I think it'll actually be quite useful for us to be able to sort of work closer with Northampton LMC as well, and sort of try and understand what's happening there, so we can make things work the best for both the areas, particularly with the cluster. And I know a lot of our colleagues have been quite worried about that, so it'll be an interesting thing to sort of work through. BadgerNet, yeah, gosh, we've had so many questions. Poor Charlotte, you've been inundated by questions about BadgerNet, and I think the problem has been there's been a change in process, particularly for practices that have had midwives that are sitting within their practice, because now there's been a bit of a change. So the big thing, and I think the thing to clarify, is that from February onwards, every single midwife should be using BadgerNet to input all their data. So how they used to, if they were working in your practice, put things into system 1, that will stop. That has stopped. It should have stopped. The only way that they will be inputting data will be into BadgerNet. Once the data is inputted into BadgerNet, it is then sent to the GP via mesh. So you should be getting all the information coming to you via mesh. So UHL had sent an email out in February, sort of explaining what kind of information will be coming to you. So that would be the booking notes telling you the woman is pregnant, etc., etc. She's had her vaccinations, you'll hear about that, and anything that is relevant. And so from February, if you're not getting that information, then please contact the LMC and let us know. And there's also an email address for UHL that you can contact them. Just remember, though, that when they moved to BadgerNet, there were already issues with communications with midwives. So from October to February, you might find that there's still a chunk of information missing. And if you feel that there's a chunk of information missing, again, please email UHL and personally, and they will send you a list of all the documents that they have for your practice and your practice patients, basically. So you should have that. The other issue that we've had is the business around, if a midwife is coming to your practice, in terms of health and safety, how would you know that she's coming to your practice, or they're coming to your practice, and what the patient list is? So the conversations that we've had with the midwifery team is that the midwife should be informing you. Normally they tend to inform a week before. They will email the practice to say they're coming on so-and-so date, and this is the clinic list, and these are the patients. And what you could do on your system 1 or email screens is just make a clinic so that the patient can be checked in and checked out. So from a health and safety perspective, you know who's in the building, who's out of the building. And appreciate that that's an extra step now for practices that they didn't do when the midwife was using their systems. But that's the only way to get around the health and safety. And I think in terms of things like prescriptions, that's another whole kind of bit that we're trying to work through, and that's been a big concern, because you know, the question of where do the prescriptions sit, particularly around urgent prescriptions like UTIs, etc., etc. So we had a meeting last week with the midwives, the community midwives, and we are trying to work through a process. I think for practices that didn't have the midwife set there, they were already communicating via emails, and the midwives being able to sort of email the GP to say, I've seen Mrs. X, can you please do a UTI, whatever, antibiotics, etc., or whatever it is, and that will carry on. The also other thing that we did raise, particularly for practices that were used to having midwives in that could communicate via tasks, how they can communicate back with midwives if there's any questions that you have or any information that you need to pass on. And what we're working through, and hopefully we'll have an answer later on this month, is to have a dedicated midwife email, so for practices to use to send any information back to the midwives. So that will be the way of communication. I hope I've covered everything, Charlotte. Is there anything I've missed out, do you think?
I think that's the general principles that most people are kind of covering, so that's really helpful.
Yeah, and if there's any queries, you guys don't get anything, then please feel free to contact us and we'll try our best.
I suppose the only thing with my mathematician hat on is just, you mentioned MESH, just for those people who don't understand, MESH is stands for Message Exchange for Social Care and Health, and it's the bit of software which allows asynchronous sending of documents from other parts of the NHS and social care to practices. So that's where things sort of pop up in your workflow within the practice. It actually sends about 60 million messages a month. What I did last time I was involved in looking at these things. So it's a big bit of software, but that's what it stands for, and that's what it is. So that's a bit of magic that allows these documents from UHL and other places just to appear in your inbox and workflow.
Great.
Okay, so let's move on. Next we're going to talk about the voluntary levy. Now, I know that we've had various discussions about this in the past, and there was a time when the GPDF got themselves into a bit of a hot water, and we criticised them, and we withheld our payments to them and whatever. But that's all been sorted out, and it's now being replaced, and every MC has appointed person who provides part of the oversight of GPDF, and for us that's Louis Dodgy, our treasurer. And where we're happy regarding it. Now, the voluntary levy fund pays funds into the General Practice Defence Fund, which was set up in 1911, right at the start of LMCs, and it funds a few different things. But one thing it funds is the GPC. General Practitioners Committee. It funds extra costs above and beyond what the BMA funds. So BMA still funds core functions, but it funds the extra plus. And so, I will be a recipient of it, and Fahreen will be a recipient of funding from it in the future. And then on top of that, it funds LMC conferences. So we go to the MC conference of England and the UK MC conference every year. I'm not going to the UK one, which is going to be in Belfast next month, and just an early announcement, because it clashes with our board meeting, and because more than 50% of our members are going to be there, we won't have a board meeting next month, so you'll have an even shorter newsletter, hopefully, to read, and shorter podcast. And those bodies we are very active on. We always say on motions, and those motions, when passed, become policy. So they set the direction of travel for general practice for UK and for England. So that's important. So the GPDF funds that. And then more recently, GPDF has been funding other things which have been really useful for us. Big one being the LMC support network, which is a way of LMCs getting together, sharing information, sharing problems, sharing solutions, sharing ideas, which is obviously a good thing to have. They're putting together a database at the moment. They're putting together a database of enhanced services from across the whole country. So we'll be able to look at what other places are being paid for, look at what the terms are for other people's services, which will then help us in discussions when we're talking about ones locally. And the other thing they provided is this database which we can actually even go down to practice level, which looks at all sorts of things like workforce and appointments and whatever. And that's really helpful for us when we're trying to support practices. And if you would like data, we can't, unfortunately, it's not one where we could just release the log on for it. But if you've got a particular reason that you need access to data, say you want to respond to an accusation by CQC or ICB or whatever, then do let the MC know, but it funds that. So it's funding a lot of good things. When we looked at this locally though, because we just get a bill for, and it's based on how many patients we've got in the area. So the MC gets a bill for the whole area. But when we've looked at it, there are some practices, minority practices, who don't pay into it. Now, I suspect this is probably historical. The only practice I've actually managed to talk to about it, so it actually just seems to have got turned off, probably again when there was previous controversy, and then never looked at sort of going back on it because, as I said, no one's actually asked us before. So we are asking you. We have written to every practice. We will write to you again. If there's a particular issue why you can't or don't want to pay, let us know. If you would like someone to talk to your team about, about what the voluntary LLR is for and the GPDF, again, contact the MC and we can run that through with your partners. But the only thing I'd say, of course, is that if your practice doesn't pay, the MC has to pay it anyway. So we have to take out our reserves to actually fund that each year. So if you are one of the minority practices not paying for it, please do discuss it within your team. And as I say, if you're not sure, again, sort of reach out to us, and so we can have a one-to-one discussion about that. Okay, it's voluntary levy. So next we're going to talk about a new and exciting tool, which has been created. First off, I'll say absolutely thank you to Sarah Gibson, who is one of our practice manager members of the board, elected to represent the county, who's absolutely done fantastic sterling work on this. But I'm going to pass over to Charlotte to tell you all about it.
Thank you, Grant. And I can't take credit for this. Obviously, as Grant has alluded to, Sarah Gibson has done all the kind of hard work. I'm just going to be able to try and present it kind of well. So this is a really kind of a good kind of service that the LMC kind of introducing to practices, in the sense of we know CQC is a key kind of issue within practices, and it's a kind of a topic that we kind of continuously kind of get asked around. So Sarah's designed a almost like a document, which is in a kind of an Excel kind of format, which takes practices through all the different kind of steps and the things to kind of consider around kind of policies, MHRA, all the kind of things that practices should be preparing for. And this isn't just preparing for 2 weeks before they get a notification. This is a document that practices should be using and working to as they kind of go along. So it should be kind of a document implemented into the kind of the workflow of practices, and that will be released in kind of due course. We are kind of conscious that obviously the CQC has just kind of gone through some changes, so we're just kind of ratifying it with themselves to make sure it doesn't kind of contradict any changes that are going through CQC. So, but if obviously any practices want access to it within the kind of the meantime before it gets released, then please contact the LMC office. And the kind of the starting point was kind of will be an introduction of it at the practice managers conference on the 4th of June. So any practice managers will get a kind of a first-hand experience of it on the 4th of June. That'll be presented by Sarah herself. And I just kind of wanted to add on a side note, obviously we've recently done we were going to do a webinar around the framework changes for CQC. Unfortunately, we had to kind of postpone that because CQC weren't ready. We'll be getting that date back in the diary soon. So I just wanted to plug that on the end of that. And I just wanted to thank Sarah for all her work on the CQC kind of toolkit, which we hope practices will use and will evolve it over time.
And just to say that as a practice, we were CQC'd last year. And having looked through this document, this would have been really helpful, because I mean, you're sitting there looking at a piece of paper saying you need to provide evidence of this, and you're thinking, how on earth do I do that? This document tells you what's policy, tells you what's information you actually need. So it would have been really helpful for us. And I hope all practices will find that really helpful going forward. So that's absolutely fantastic work. Next, we're going to talk about contract. What contract? Yeah. So we're talking about the post-contract from 26-27. As you hopefully lots of you voted in, there was a referendum. About 17,000 GPs and GP registrars voted. 98.9% voted against the imposed contact, and to call on the government to return to negotiation with the BMA's GPC committee for England to jointly develop and agree a brand new contract. I wonder who the other 1% of GPs are. Maybe they're all the GPs that work for NHS England and other such bodies, perhaps, or haven't actually read it or thought how this is going to, again, and just going back, I'm not going to run through all the changes, but just to say that they're not going to improve general practice. If anything, they could cause more harm. Last year, we predicted that the last year's imposed contact would cause a problem, and fun enough, it does. Lots of practices have told us about how much extra work they're having to do, how much problem it's caused between them and their patients. And come 1st of October last year, when the main bits came into place, funny enough, there was a 5% stepwise increase in low acuity attendances at ED. So, so the government, having learnt from the information and data and evidence, of course, have done the same again. Absolutely. That's what we expect of them. So what's next? There will be so the GPC England, and hopefully now we've got an insider, we'll get information quicker. We'll be considering about what action they'll be asking practices to do. We can't do industrial action. Obviously, we can't strike because we're not employees. We're contractors, but other forms of industrial action would be similar to what we've done in the past, the collective actions. And we hope that practices will join in doing those, just to give a real message back to the centre. And just while we're on the topic, despite what the ICB has put out twice, you do not have to follow what's in the contract from the 1st of April, because there isn't a contract at the moment. All we've got is a letter saying what they propose to put into the contract. Now, I did break it down actually within the newsletter, but as you're probably aware, our contract is by statute, and the core underlining is the regulations, 2015 regulations as amended. So what will have to happen first is that there will need to be a secondary legislation as a direction to change the regulations. Once that's been done, the wording for the contract will need to be changed, and normally they go back to GPC to try and agree to that. Once that wording has been changed, that then needs to be turned into a contract variation notice, and then that notice has to be served on practices. You only have to change your contract because by default, by fact that your contract has not changed until either you have signed that contract variation notice or 14 days has passed since you've been served with it. We're actually asking practices not to sign contract variation notice because, as I've just said, it doesn't make a blind bit of difference. But what it does do is it gives a message back saying that you are not you're not happy with it. And then just going back, of course, this is secondary legislation. As I expect most people will know, secondary legislation has to be laid in the House. Technically, it means that they actually put a copy in the library and make it available to all parliamentarians. And then most secondary legislation is on the negative route, which basically means it stays there and becomes law unless someone challenges it. And it can be annulled either by a majority of parliamentarians that say they don't like it for whatever reason and they go to debate, or there can be what's called a prayer which is a motion which is read in the House and agreed, and the prayer can lead to annulment of secondary legislation. Now that takes 40 days. So as you can see, 40 days to get a change in regulations, and then there will need to be the change in the wording, and then there will need to be a contract variation notice. So by my reckoning, I think we're not going to see anything for at least 2 months, because having checked on it again, so far, the proposed secondary legislations, change regulations, has not been laid before Parliament yet. So in that first 40-day period still hasn't started yet. So there is no new contract. We've got a proposal from the government what it's going to be, but until it gets turned into a contract, you do not need to do anything. So you can read what's in Pulse and other places. You can read what other people are saying. You can read with interest the ICB telling you that, or have regard to what you're supposed to have done for the first April, and then you can ignore it, because at the moment it's a SEP. It's someone else's problem. In fact, it's Parliament's problem, because they need to sort out the second legislation first. Okay, any questions about that, you two? Is that clear?
So I was just going to clarify, but you kind of did that at the end. So from a practice perspective, it's business as usual in relation to what the contract variation was from October, I believe, from last year.
That's right. Yeah. So at the moment, all you have to do is to comply with the 25-26 contract.
And I think that's the key thing as well, that actually there were some changes that happened in October. So practices do need to comply with those, because that's happened. The contract variation has happened. And I think some practices may not have realized that. So I think there were some key things in there. For example, the silly things, not silly things, sorry, I'll take that back. But the things like the LFPSC, you needed to be registered, etc., etc.
Yes.
And I'm aware that some practices in LLR still haven't done that. So they do need to do that, because that was part of the contract in October 25. So I think just wanted to sort of raise that for them.
And for that, you only need to register with them.
Yeah,
you don't need to be using it.
No, just
you don't
register.
have any regard of it. You just have to have registered with it, and they can check that. So they can check with the FPC whether you are registered or not. So please, if your practice doesn't, please do that, because it's a simple one. It just keeps people off your back.
Exactly.
Okay. So are we? Any more questions about the contract?
No.
I mean, just the other thing, of course, is that there was this promise from the government that during this parliamentary term there would be a review of the Cahill formulary, and that we would have a brand new replacement contract. And the word that we're getting from GPC at the moment is that those discussions haven't even started. I mean, in terms of the Cahill formula, they've actually said that they're not going to talk to the GPC about it, which I find is really bizarre. And I know that they are taking evidence about that, because they've talked to our local people about the equity payments. So we do know that there's been some discussions about it, but as far as I can see, there's been nothing. No major work done on it yet, and there's been no discussion at all about the actual contract in total. Okay, so that's years away, I expect. Anyway, and we're now moving on to another exciting area, which Fahreen's going to talk us through MOF.
Yes, so this is around the medicines optimization framework, and last month Grant shared in the newsletter around sort of what the LMC feeling was around the MOF. So Rima Pervez, who's one of our LMC board members, had done some work on this, and and she'd done some costings up, etc., to try and show how much it costs a practice to do this and what it may bring for you. And although she managed to sort of bring it out as cost neutral, I think one of the key things was actually while it may be cost neutral, you're not taking into account the fact that the pharmacist could possibly be doing some other work in the practice. So I think that doesn't always come in, and that's quite hard to quantify depending on how the pharmacist works within a practice. So we as an LMC felt that MOF wasn't something that we would support. We didn't feel that it necessarily brought value for money. I appreciate what a lot of practices have come back and said, well, we end up having to do things like, the eclipse and all that. And so, what happens with that? And I guess that will carry on. on. The issue that we don't know, and one of the answers we never got back from the MOF team was, if you did some bits but didn't do the other bits, would you get part payment? And I don't think that was the case. It felt pretty much like it was an all or nothing. So each practice has to make up their own decision as to what they think is right. But I think as an LMC, we didn't feel that we could support it for the payment that was sort of being offered. So if you have already signed up and you feel that you don't want to engage in it, there's no reason why you can't take that back. And, you know, if more practices were to do that, I guess it would really make the ICB think about, you know, what it actually means for general practice, and whether, if they feel that it is that important, whether they need to be funding that and resourcing that in the right way. So it was just a little bit around what we feel around MOF. Thank you.
Thank you for that. Any other questions about that, Charlotte?
No, that's absolutely fine. I think if any practices have any kind of questions, then obviously, as we always say, our door's always open, our phone's always on to kind of contact us around that.
Yeah. Okay, thank you. And then, last thing we're going to talk about today is events. Again, I'm going to pass on to Charlotte to talk us through what's going on at the moment.
Perfect, thank you. So we've got a couple of events that are kind of coming up, and we just wanted to kind of highlight them to practices. Practices will probably be aware that there's been some kind of employment changes within the kind of the nationally, and so we've got DR solicitors coming to us to give a couple of events around those kind of changes and how it can kind of support practices. I can kind of those dates are next week. So one's on, the first session is Thursday the 23rd of April, 1 till 2, and the second one is the following Thursday, which is Thursday the 30th of April, 1 till 2. So if anybody wants to attend, we can send you the kind of the link. We'll also be recording it, so obviously practices will be able to have access to it afterwards. And then I just wanted to highlight the other event that's kind of coming up. So the LMC has kind of formed a admin safeguarding group. So basically the people within your practice that kind of delivers the admin side of safeguarding have been kind of brought together to try and develop a kind of a community peer support group in relation to supporting practices with this kind of area. We've now delivered a couple of face-to-face kind of events, which is hosted by the LMC and run by Dr. Rastogi, who's the LMC board member as well as the GP name safeguarding lead within the ICB. So that next event is on the Tuesday, the 2nd of June. It's going to be a face-to-face again. If practices want to kind of attend and nominate their admin safeguarding lead, then they're welcome to join. And all details are kind of included within the newsletter today, so that's available to practices.
Yeah, and just to come back, that those first two sessions are about the new Employment Rights Act 2025, which brings in lots of changes, and it will affect practices and how you employ people. So it's really important that you have at least one person actually goes to these to understand, just so you can keep yourself safe and away from criticism, away from being challenged in employment tribunals, etc. So, which we want to stay away from. So please make sure at least one person signs up to both those sessions. And we've come to the end of what we wanted to raise with you today. So I can just say sort of thank you all for listening, and hopefully we'll join up again next month. Thank you.
Thanks all.